We need to be the most interdisciplinary field to truly advance the health of populations, which means that a Master of Public Health isn't the only way to go. In this episode, we'll be talking about some other master's degrees that can land you a career in public health and where that expertise can make an impact.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. My name is Gordon, your host for this episode, along with my capable co-pilot, LaShawn, Benedict, and we are ready for takeoff.
Let's go.
So this episode is for those who either don't have an MPH or those who are not able to pursue it for whatever reason, or those who might already have a master's level education that is not an MPH. Mm-hmm. We often get a lot of questions from people about how to get in an MPH program. MPH programs now have become very competitive, and people find themselves at a crossroad about how to break into the public health field when their experience wasn't like a bachelor's of public health or a master of public health. We're here to tell you that you do have an opportunity to have a major impact in public health, even if you don't have an MPH. The root of this question can be best answered by talking about what public health is in the first place. So, LaShawn, what would you say in a nutshell is public health?
Public health is everything.
Okay.
Now, what do I mean by that?
I don't know if that was very helpful. Okay, you're gonna get into it?
Yeah. So the way I think about public health, I've been on record 1,000 times saying public health is extremely broad field by design. Because when we're talking about big picture things like improving the health of communities, populations, these things are not easy. When we're talking about public health, we're really talking about ensuring those conditions necessary to have these healthy communities. So when we're doing that, when we're thinking about this, we need to think about housing. We need to talk about social support. We need to talk about education. We need to think about healthy public policy. We got to think of work conditions, built environment. Public health is a lot of things. We're talking about values like prevention. We're talking about upstream approaches to health. So as you can tell, there's a lot in there. And it's really hard to define public health just because of that broad nature. And the purpose of this episode is to just talk about that. You don't need a master's of public health to be in public health and work in public health and have those public health impacts.
Precisely. And I would say too, one thing that people maybe get confused with is, well, I don't work for a public health organization, so I'm not doing public health work. But that is not true. There is a difference between working in what you might consider to be a cookie cutter public health field versus working in a space that allows you to have public health impacts. In both cases, those are very important to global public health outcomes. So the question is not, do you work in public health? It's what impact is your work having on public health? And then that allows you to see more clearly where you can fit in the space.
So why don't you tell me an example about what that looks like? Specifically, someone that would be saying, oh, I don't work in public health, but they do indeed have that public health impact.
Right. A good example, one that's front of mind because of the housing market and the housing crisis and the high number of people that are sleeping tough on the streets, is the housing industry. So in public health, you might be working and an agency that either advocates for more housing, that provides services to people who are housing deprived, and that's you working in the public health space, trying to impact the socioeconomic status, impact social determinants of health being housing. Just down the road, you might have LaShawn Benedict in a parallel universe who is an affordable housing developer who does not have a Master of Public Health, and his degree might not be related to public health at all, but the work that he does is absolutely essential for us addressing the housing crisis, in that his passion and goal and purpose is to create and develop affordable housing, which then directly supports people living on the streets, who can then be supported by a public health agency to transition from the streets into a situation where they have a roof over their head. So that's one of the examples that's probably the easiest to conceptualize.
Yeah, I really like that example. And I think it leads to this larger discussion about framing around public health. And one of the things, like you're mentioning these examples, these people do this great work with public health impact, but they just don't know how to frame that experience to make it into more public health sounding terms. What they are doing is public health, but they might not be aware of that. And they don't know the terms and concepts and lingo that we love talking about in public health. So, knowing that information, where do we go from here, Gordon?
Where do we go from here? I can tell you that the gist of our conversation so far is that public health, by its very nature, the end goal is health for all. And to have health for all, public health must be a multidisciplinary field where we address the silos that are in place, engage people who aren't necessarily working in public health, but their work has public health implications. And that's the only way for us to make any true advancement to bettering the health outcomes of equity deserving populations. So that's where we go from here. Where we go from here is we don't consider public health work as something distinct from work that has public health outcomes. That's where we go from here. So having said all of that, we hope we've inspired you to think about your experience that you already have, or think about your future experience as something that you can bring to the public health table. And for those of you who are interested in pursuing graduate education, who maybe aren't in a position or don't want to do an MPH, we're here to tell you that there are options out there for you to get the knowledge required to enhance public health practice in a variety of different ways. So one degree that I know for sure, because in my work, I often work with a lot of these people in these professions in public health, is social workers. So social workers, a lot of times you have a bachelor's of social work. Some of them go on to do a master's in social work and are registered social workers. There's a lot of overlap with that profession and a master of public health, in that these individuals understand the social determinants of health, understands the socio-ecological model and how the individual and the interpersonal and the communities and how that relationship has public health implications. And they undoubtedly help to advance public health practice based on the unique skill sets that they have. Are there any ones that you know of that stand out, LaShawn?
Yeah, I work with many individuals who have a master's of social work. There's a bunch of other masters that you can use to transition into public health and bring those relevant skills and new skills into the space, whether it be a master of public administration, a master's of public policy and administration, a master of health administration, masters of health informatics. There's so many different masters you can use to come into the field. And it's a great thing, right? Because when we're talking about this interdisciplinary field, we want these different perspectives. We want these different approaches to tackle public health problems. Do you want a team full of master of public health people, MPH?
Right.
Do you want that? I think it's great. We have a very broad training base, but I think it would be a much stronger environment if you have people from these different areas that could bring different skills and different perspectives to ultimately strengthen your program planning, interventions,
Right.
policies, and programming.
Right. And sticking to our example early on about housing and community development, there's Master of Urban Planning and Master of Community and Regional Planning. So on the face value, urban planning, that's something that the city would do. That's real estate. That's developing infrastructure. What could that possibly have to do with public health? Well, like LaShawn said, one of the key determinants of health is the built environment. And you will have the background knowledge to be able to provide recommendations in a public health setting as to things that a Master of Public Health trained person might not be aware of based on the way that they were trained and the knowledge that they gained in their training. So things like transportation, accessibility, green on the building to reduce the amount of heat that hits the floor, climate change. These are things that a general Master of Public Health might not provide you, and as well as a specialization in like epidemiology would not provide you. So there are opportunities for everyone to contribute positively to a public health goal of enhancing health for all.
Absolutely.
What about an MBA?
Exactly. Even an MBA, you learn so many different skills in management. One of the things we need more of in public health is solid management. How are you able to direct, influence, negotiate with other people when you're talking about different resources in public health? When you're talking about the limited funding in public health, how are you able to navigate these more practical situations? Those are good things to learn. Like even in the business field, we could learn from them.
Yeah. And even from the MBA, looking at an MBA from a leadership perspective, someone has to lead people doing the work, right? We often hear about wicked problems and problems that we've been fighting for years. For people who've been working in public health for a number of years, it can get quite demotivating to feel like you're not having an impact. And you need effective leaders to be able to motivate, like LaShawn said, get the best out of people, create an environment where people feel included to be able to go out there and work on very difficult issues. And while this is not something that you would consider to be a technical skill in public health, it is important for public health organizations. It is important for public health practice.
Exactly. Again, this list is very long of master's degrees. We'll include a list in the description of all the different master's programs that we've talked about, whether it's Masters of Human Kinetics, Masters of Education, Master of Health Studies, Masters of Kinesiology, Masters of Science in Global Health, Epi, Biostats, Health Studies, Health Systems, Pharmacies. The list goes on and on. Even Masters of Art in Community Development, One Health, or Leadership. There's so many things we could draw upon to learn more and enhance public health teams, public health groups, and our organizations. Gordon, take us home.
I thought you were going to list more. I was enjoying
Take us
that.
home.
We're not going to list anymore?
We'll leave in the comments.
Okay, yeah, we can't list them all, right? Well, because we can't list them all, we're asking you to help us. Let us know if there's any other masters out there that you've done or that your colleagues have done that have set them up nicely to make a positive contribution to public health. We would certainly like to hear about that. On that note, this was Gordon and LaShawn, your favorite public health professionals, signing off.
Peace.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.